evening. My name is Melissa Lee, and I am the Director of Admissions and Regulatory Compliance here at Penn Nursing. Welcome to what is the second of our webinar series entitled Diverse Perspectives in Nursing. This webinar series is in conjunction with the Thurgood Marshall College Fund. We are partnering with them. So we'd like to welcome any students who are attending the HBCUs within the Thurgood Marshall network. I'm always proud to say that I'm a proud alumna of Cheney University, the first HBCU. Also welcome to everyone else who is joining us this evening. First, I'd like to start with introducing my colleagues who will be presenting this evening. We do have a full agenda. First, I want to introduce my colleague in the admissions office, Jamie Bergstein. Jamie is our Associate Director for Graduate Admissions and Marketing here at the school. Jamie, if you want to give a little wave. And then I'd like to introduce the faculty who will be on the panel this evening. Dr. Lisa Lewis, who is the Associate Dean for Equity and Inclusion. Dr. Sue Renz. Dr. Debbie Becker. Dawn Bent. Dr. Dawn Bent. And Dr. Margot Brooks Carthon. And is Dr. Jessica Strom-Farber on?
I'm here. Good evening, everybody.
Okay, there you go. Hi, Jessica. So our agenda for this evening, we'll start with a presentation by Dr. Lisa Lewis, who will talk a little bit about Penn Nursing's position on diversity, equity, and inclusion, and a little bit about the services that support our students, as well as our student organizations that are under her office. Then that will be followed by Jamie Bergstein, who will provide an overview of all of our graduate programs. And then we will have our faculty panel, the panel followed by a Q&A. If you have any questions during the presentation, feel free to put them in the chat box and we'll try to get to them all as best we can. This session is being recorded and we will send it out afterwards within the next few days. I believe all your mics are on mute, but if you'd like to keep your cameras on, we'd love to see your faces this evening. And we also like to know who's joining us this evening. So if you could also put in the chat box where you're joining us from. If you're representing an HBCU, please shout out your university, or any university, any student that's an undergraduate, shout out your university in the chat box. We're also very interested to see who is joining us from the furthest distance. So with that, I will go ahead and get started, and we will turn it over to Dr. Lisa Lewis.
Good evening, everyone. It is a pleasure to spend a little bit of time with you. I just do want to give a caveat. I had a beautiful presentation for you all that is now on my dead laptop. My laptop died just about an hour ago, but I will make sure that Melissa and Jamie have the presentation to send to you when they send out the link. As Melissa said, I'm Lisa Lewis. I am the school's Associate Dean for Equity and Inclusion. It is a role that I have held for a couple of months, but prior to that, I was the school's Assistant Dean for Diversity and Inclusivity. And for those of you that don't know, the jump from assistant to associate indicates that the school has endorsed an elevation of our diversity, equity, and inclusion mission. So what does that mean for the School of Nursing? It means that we believe so strongly in diversity, equity, and inclusion that we have made it a part of our infrastructure at the School of Nursing. The main goals of the office are training and education around diversity for our students, staff, and faculty, community building, such that we can have an inclusive climate. And I serve as a resource for individuals who have questions. And I do a lot of partnerships with students, as Melissa mentioned. Two of our important student groups are Minorities in Nursing Organization and the Asian Pacific Nursing Student Association, otherwise known as the PANZA. These two student organizations are doing phenomenal work for the school and the West Philadelphia community in the spaces of diversity, equity, and inclusion. Some of the work that they are doing involve advocating for the homeless through interaction with local government. They have been involved with getting folks to complete the census and registering to vote. They host multiple events, the latest one, Racism in Healthcare. I bring up the students because they are an integral part of our mission, and to show you examples of the ways that students are engaged in our work to foster diversity, equity, and inclusion. Our faculty and staff are also very much important in this mission. Some of the ways that our faculty and staff have helped to foster diversity, equity, and inclusion in the School of Nursing is by participating in some of our important trainings. Every year we do trainings on bias and microaggressions. We have folks from the Center for Teaching and Learning come in to help our faculty make sure that their teaching and learning environment is inclusive. But one of the most important things, I think, in the space of diversity, equity, inclusion at the School of Nursing is that we lead with it first and foremost. And it is definitely a priority for our school's leadership, Dean Tony Villarreal. Thank you. I know I only have 10 minutes, and so I could say a lot more. And the PowerPoint does have specific details for you, and happy to take questions.
And Lisa, if you wouldn't mind just giving us a little background about your career, and your educational journey.
Yes, sorry, Melissa. Yes, you did ask me to do that, and that was included in my position. So I've been a nurse for almost 30 years. And I tell students often, and as much as possible, as much as they'll hear me, that I am the proud daughter of immigrant parents who came to this country in the late 60s looking for a better life. I am the proud daughter of a single parent. So I ended up being raised by my father, who didn't have much education. And I actually have just started sharing that widely because Penn nursing students do represent a similar background. When I went to nursing school, I wasn't sure that academia I actually wasn't thinking of academia at all. And I think a lot of us on this call would probably say that. And in my presentation, I did have pictures of my first job in New York City, where I'm from, Mount Sinai Hospital. This hospital is situated in the Upper West Side of Manhattan in New York City, Upper East Side, in a neighborhood that houses and still continues to house the very poor of New York City and the very wealthy. And so this hospital takes care of both of those demographics. What I saw pretty early on in my first job on an inpatient adolescent unit there was that our wealthy patients, our white patients, didn't come in for the kinds of things that my poor patients of color did. So my poor patients of color They were like revolving doors. They came in exacerbations of chronic illnesses that we know can be managed easily at home. And so that started a set of questions for me that I knew I couldn't answer without further education. So I went to school part-time for my master's at NYU, and more questions came, and ended up earning a PhD because I felt I could impact nursing in a better way through education and research. So Melissa introduced me as the Associate Dean for Equity and Inclusion, and that is a big part of what I do at Penn Nursing. But I'm also a faculty member. I teach in the undergraduate program, one of the required courses, a course on the social determinants of health as they relate to nursing and the nursing process. And I'll have you know, we have been teaching this course well before the social determinants of health have become so popular. So it's a required course. I also teach a PhD course, Health Equity. It's an elective course, but again, so timely and so important for the work that we do as nurses. And finally, I'll just share a little bit about my research. I'm a behavioral scientist, a health disparities researcher, and I work in the space of hypertension management for Black individuals, with a more recent focus on Black men who suffer disproportionate rates of hypertension and twice the death rates compared to their white counterparts. And my last thing I'll say is my most recent project, the project that I'm working on right now, is a diversion project with colleagues in the School of Education and the School of Social Policy and Practice to reduce incarceration rates for Black men through a diversion program that integrates health, education, and social services. I could have said this so much better with my PowerPoint. And so I'm a little off kilter because my computer died, but I promise you, you will get all of the details in the presentation. Thank you for reminding me, Melissa.
Thank you, Lisa. At this point, does anyone have any questions for Lisa? You can either type it in the chat box, or you can take your mic off mute and ask her a question live. Okay, is everyone being shy, or are there any questions? Okay, well, we'll keep moving on. Thank you again, Lisa, for your wonderful presentation. So we will move on to Jamie Bergstein. Jamie, if you wanted to now go through a review of all of our graduate programs. And again, feel free to, if questions come up, you can put them in the chat box, and then we'll get to them as we go along. But if Jamie, if you wanted to go through the review of all of our graduate programs, and then that will be followed by the rest of the faculty on the panel. And they'll talk a little bit about, again, their career journey, their educational journey, and a little bit about the programs that they manage.
Okay, I'm going to share my screen again. And this is going to be a very brief overview because you'll hear more about our programs directly from the faculty. We have a variety of programs, even though we're not really focusing on our accelerated BSN programs. For those of you who are currently not nurses, but are interested in becoming a nurse and perhaps an advanced practice nurse, you can apply to our accelerated BSN program, which is 18 months long. And at the end, you receive your Bachelor of Science in Nursing, and you can sit for the NCLEX and become a registered nurse. You can also apply to the BSN MSN program at the same time, where if you are currently not a nurse and would like to become a nurse, and you know you want to become an advanced practice nurse, you're interested in a specific area, you can apply to those at the same time. For those who are currently nurses or in nursing school, you can apply to our MSN programs, which are our nurse practitioner programs. They can be completed on a full-time or part-time basis. It is actually quite popular for our students to complete the MSN programs on a part-time basis. So you can maintain a job while completing your MSN program, which is very attractive to some people. You don't have to quit your job. Right now, our programs are being conducted remotely, but traditionally classes are offered on campus, and clinical placements take place in Pennsylvania, New Jersey, and Delaware. And I always say this because we have people tuning in from all around the country. For those of you not familiar with this area, New Jersey and Delaware are very close to Pennsylvania. So, you know, New Jersey and Delaware are really just maybe 30, 40 minutes, depending on where you're driving from Philadelphia. As you can see, our programs focus on population and acuity level. So perhaps our program directors can talk a little more about the consensus model, which states that where you're licensed in, the population that you're licensed in is what you're practicing in. So for example, if you become an adult gerontology acute care nurse practitioner, you're caring for adult patients in an acute setting. So the focus is on the patient needs, not necessarily the location or setting. And I'll let the program directors talk a little bit more about that because that's their area of expertise. We also have 2 administration programs, which are non-clinical, as the name implies. They focus on leadership, healthcare administration, management, quality improvement, advancing through the management and administrative side of nursing and healthcare. We have doctoral programs. We have our PhD program, which Dr. Lewis mentioned. This is only offered on a full-time basis. It's about, most programs are 4 years long. It may take you a little longer depending on your research topic. Our full-time students are fully funded for the first 4 years of the PhD program. And Dr. Brooks Carthen can speak a little more about funding. We have a variety of research centers, but the 2 we like to highlight are ways that you can be funded. So you can be on school funding, or you can be funded through the Center for Health Outcomes and Policy Research, or CHOPPER. We love acronyms here at the School of Nursing, or the New Cortland Center for Transitions in Health if your research interest aligns with one of those research centers. We have 3 DNP programs. First is our nurse anesthesia DNP program, which leads to becoming a certified registered nurse anesthetist. This is full-time and 3 years long. And then we have 2 postmasters DNP programs, which Dr. Renz oversees. As the name implies, you do need a master's degree in nursing or a related field to complete these, and these focus on leadership, management, fiscal management experience, and both of these are part-time and 2 years long. And the postmaster's DNP and the executive leadership DNP are both online. I realize that was very general, but we have our wonderful faculty experts here who can dive in a little more to that. I'll just highlight them now while I have the floor and I'm sharing my screen. We have several events coming up over the next few weeks and spring. We have our open house next week. We have an admissions webinar in a few weeks. The next event in our series is a careers in nursing panel where we'll have representatives from several Philadelphia area hospitals to talk about careers in nursing. And we also have a webinar coming up in May for our Postmasters and Executive Leadership DNP program. So if you want more information to go more in depth than what's being presented here tonight, we have several upcoming events. So with that, I will turn it back to Melissa.
Great, thank you, Jamie, for that overview. So we will go right into our faculty panel, which, I'm sure that's what you're all here for this evening. I didn't have any particular order, but I thought maybe in order of the slides, if we could first start with the MSN programs. So that would be Sue, Jessica, and Debbie. So if we want to, I'll just randomly start with Sue, and then maybe we'll do Debbie and then Jessica, and then we'll move into our doctoral programs. So Sue, I'll turn it over to you.
Thanks, Melissa, and good evening, everyone. And wow, looking at the chat box and seeing that people are tuning in from all over the country. So welcome, and thanks for taking the time to be with us. So my name is Sue Renz. I'm the director of the primary care programs as well as the DNP program. And I would have to say that I never left Penn. I was born at HUP, which is the hospital of the University of Pennsylvania. My mother was an alum of the HUP School of Nursing, and I think I was destined because of my my roots being at the University of Pennsylvania to somehow end up back there, both as a student and now as a faculty member. I always wanted to be a nurse. I wasn't sure what focus my career would take me, but I did attend Penn nursing as an undergrad, graduated in 1984, so I've been a nurse for a very long time. And then I completed the geriatric or the gerontology nurse practitioner program in 1987, prepared as a geriatric nurse practitioner. The focus of my practice over the years has all been on care of older adults. And that really came to be, and my awareness to that emerged from my work in the hospital as a new nurse, caring for patients on a medical surgical floor, many of the medical patients coming in from the nursing homes in the Philadelphia area, and some of them coming in very poor condition, having been restrained or poorly nourished, and with bed sores and just not having family or caregivers to support them. And that's kind of where I really decided that I wanted to focus on care of older adults, and somehow it was a dream of mine to somehow impact clinical practice and clinical outcomes for nursing home residents. And that has been the focus of my practice as a nurse practitioner from 1987 until the present. I've, like I said, worked in clinical practice. I've been a director of nursing. I've been a corporate nurse, a consultant. I started my own consulting business helping nursing homes who had quality of care issues. And then somehow came back into academia, first as a part-time faculty member, and then later as a full-time faculty member. I'm being recruited to teach in the adult gero primary care program, and then later becoming the associate program director and then the program director. I was appointed the primary care program director. I think it's coming up on 3 years. And those programs that are under my direction include adult gero primary care, women's health, midwifery, psych, pediatric nurse practitioner, and family nurse practitioner. So I teach in 2 of those tracks, as well as I teach in the Doctor of Nursing practice program. In terms of my education, in 2010, I went back to school after many years while my kids were little to complete my DNP at New York University. And really the focus of my scholarship there was looking at communication patterns within nursing homes and how to improve communication between nurses and providers regarding change in clinical status. I found after completing my DNP that I wasn't finished with my scholarship, and later pursued a PhD at the University of Arizona, which I completed in 2017. the area, again, of my research there was looking at exactly how nurses communicate clinical changes, like the words that they actually use in phone call conversations with physicians and how that impacted clinical decision making. So that's a little bit about me. In addition to my teaching, I do work on grants. I work on a grant now with family medicine docs, where we have a fellowship where we train family medicine physicians as well as physicians assistants on care of high utilizer patients and patients in the West Philadelphia area that are underserved and have social determinants of health. And I'm very grateful to be part of that interprofessional team. And that's a little bit about me.
Great. Thank you so much, Dr. Wren. Dr. Becker, would you like to go next? Your mic is still on mute.
Yes, I am muted. I apologize for that. Thanks for everyone for coming out and taking some time out for you to figure out what you want to do with the rest of your nursing career, or if nursing is your area that you want to move into. I've been a nurse for as long as Sue Wren's. I didn't realize that. Graduated in 1984, so that, if you do the math, is about 37 years this spring. That's a long time to be in nursing. I didn't always want to be a nurse like Sue. I wasn't meant or born to be a nurse. I went to an area college. I was first in my family to ever go to college, so that was momentous. I heard it from being a kid that, you know, you're going to go and you're going to get a good college education, and you'll be able to take care of yourself, because my mother felt that she was always very dependent on her husband and her father, and so she wanted me to grow up being independent, which I think has worked, generally speaking. You can ask my husband. Although we've been married for 35 years, I'm pretty darn independent, and he will verify that. Anyway, for my career, then I went to college. I wanted to be a doctor, of course. That's the thing that most people wanted to be at the time that I went to college. And then I met this man at college, and I fell in love with him, and that kind of messed up things, and started dating him, and decided that I didn't really know what I wanted to do, and I didn't want to do research. My studies were in biology, higher level mathematics and stuff, and I was like, you know, I don't know, what can I do with this? I don't want to work in a lab. And somebody said to me, well, did you ever think about nursing? And I'm like, no, actually, I never have thought about nursing. So I went on a personal journey of, what do nurses do, and what can they do, and what would I be interested in doing? And I spent some time with somebody in an ICU, and I'm like, I love this stuff. I love the technology. I love gadgets. I love machines. You find out I did my dissertation in simulation, so that makes sense. So I really like technology. And so critical care was where I went. So I went to a second degree program, an accelerated program that some of you are interested in completing. I did not come to Penn's program because at the time I was poor, because I had just finished a regular bachelor's program. I also didn't think I would get in. And so, being from the Philadelphia area and kind of knowing Penn's reputation, I'm like, oh, I will never get into Penn, so I'm not even going to try. And so I went to an area nursing school, and that did accept me, and I became a nurse. And I think it was one of the best decisions I've ever made. I love being a nurse. Nursing is one of those professions where you get bored, which I think is amazing if you actually get bored in doing anything in a nurse. But if you would get bored in an area, there's another area you can move into. You can specialize more. You can do primary care. You can do acute care. You can do critical care. You can do home care visits. I did home care for a year, realized I don't like going into people's homes. So I stopped doing that after I saw my patient. I started my career with this one patient and saw him throughout my entire year. And when I was able to release him from care, then I was like, I'm out of here too. Thank you. We're done this program together. That was a very interesting year, but it was great to be able to have that flexibility of making your own schedule, making appointments with patients, and being able to know when what your life schedule was with my children and family, and then what I could go ahead and do with my patients. So it was kind of a year that gave you some flexibility, but going into people's homes and in the neighborhoods, I had no idea where I was going, and getting lost. And this was before GPS, So my map was not as good as a GPS is now. I was working in a critical care unit, started out in like in GI, and then I moved to cardiology because I really liked the heart, and finally a position came available, and then I moved into cardiac care unit and loved it. And I worked with a girl who was going to Penn for her master's, and so I'm like, oh, if she can get in, I can get in. Like, you know, I was getting cocky now in my time. Like, I should be able to do that, and I can afford it now because I have a job. So applied to Penn and got into the critical care clinical nurse specialist program at the time. There was no NP role in critical care or acute care. The only way you could get in was through a clinical nurse specialist, which, as the name says, you're a specialist in a particular area of critical care. And you really worked with the staff and the patients for them to understand why they were doing what they were doing, what the purposes of the care was, so that you could better understand. If you understood and the patients understood, then everyone was working together to really have better outcomes. And so that's what a clinical nurse specialist was there to support the staff, support the patients, and also help with retention, because if the nurses feel like they're supported, people will stick around in their jobs more than if you feel like I'm out here floundering and nobody's out here helping me at all. Did that for a while, but then it became, the CNS role was kind of steeped in patient care. So if there was staffing issues, then we were all pulled from our roles as clinical nurse specialists and pulled into taking care of patients, which I don't mind taking care of patients, but that wasn't, I also had this full-time job as a clinical nurse specialist that they still wanted me to do. So now I had two jobs. I'm like, okay, this doesn't seem as stable. And there were times when they were like, okay, you're just going to have to go back to patient care full time because we can't afford to have clinical nurse specialists. And so because of that, I explored the fact of, well, what's this nurse practitioner thing in critical care? What's that look like? It must be like a glorified resident, right? Like you're basically, a provider, you're doing, taking blood and watching blood pressures and titrating medications and stuff like that. And so came back and talked to my program director, who was now transitioning the clinical nurse specialist program into a nurse practitioner program. And I started working part-time and taking classes in the NP program at the same time as I was in the NP program. So that was an interesting time in my life of transitioning into a faculty role and also like grading my classmates' papers and stuff. So that was a very interesting time. But the deal was that if I finished the program, I could be the assistant program director with Dr. Roz Watts from many, many moons ago. And that's what I did. And we had a technology class in this course that we have now adopted into our acute care NP program. And Jessica, who runs the pediatric acute care program, her students who are concentrating on critical care join us in that course. And we work about, just all the technologies and how do you use it and what do they mean. And again, love that course. That was my course when I got out of the program. That was the one that I directed. Now I direct the entire acute care nurse practitioner program. So adult gerontology population. So thinking about my transitioning through the role of the nurse, it's been quite an interesting path. I will say that when I was in my first nursing course, there was this, adage of, those who can't do teach. And I'm like, no, that does not apply to me anymore because I can do all this stuff. And that's why I'm teaching, because I want to make sure the patients are taken care of as well as they can be. And if I help drop all this knowledge on all those people who want to take care of acutely ill patients, then I think that I'm contributing to improved care for patients. And so I have worked mostly in cardiac and medical ICU, but I've done some surgery type of care. The only thing that I really wouldn't claim is anything neurosurgical. You wouldn't want me to be your neurosurge nurse practitioner unless you didn't want to have much of a neuro status when you woke up from whatever problem you had. But I love nursing, been teaching. I love to teach. I like the technology. As I said, my dissertation was looking at face-to-face case study reviews versus case study reviews in high fidelity simulation settings. And of course, makes sense, at least to me it did, that you would have a lot more critical thinking skills going on in a high fidelity simulation where you had people doing things and interacting with the mannequin than you would in a round the table, face-to-face discussion of a case. And so got my PhD from Drexel School of Education and started continuing to teach in our acute care program. And then for a while there, directed our simulation center for about 5 years. Really helping to expand the use of simulation into the primary care areas because it wasn't really being used much at all. And we had we still do have this very wonderful Claire Fagan Center for Simulation, Innovation and Simulation, and with all the bells and whistles that you can get, but also some of the very, task-oriented type of things, and being able to learn how to suture and read EKGs and chest x-rays and all those good things that you need as a nurse practitioner who is managing the care of acutely ill patients. So instead of me just rambling on and on and on, I will let Jessica take over now. Jess?
Melissa, do you want to pause for questions, or do you want me just to continue on? What would be best?
You can continue on. I'm keeping track of the chat.
Okay.
We do have someone who would like a little bit more information on the postmaster's DNP too when we get to the doctoral section. But Jessica, you can go ahead and get started.
All right. Well, good evening, everybody, and thank you all for being here, joining from all across the world. It seems we've got some folks from across the country and across the globe. So thank you for being here. So I am probably the outlier here. I don't take care of adults. I take care of little people. And I think I wanted to be in healthcare since I was in kindergarten, and decided that I want to take care of children somewhere in probably my teen years. I have been a nurse going my 27th year this year, and all of my nursing experience has been with little people. So I've worked bedside in the NICU, the neonatal intensive care unit. The bulk of my experiences has been in pediatric intensive care. I've also spent time in the pediatric emergency department, and then also spent quite a bit of time in the pediatric and neonatal critical care transport world, taking care of patients in the back of ambulances, on helicopters, and on medical aircraft. So that's kind of where I've spent my time. I've been a nurse practitioner since 1999, and my really area of specialty and certification in that is in pediatric critical care. I'm currently a nurse practitioner in the pediatric ICU at the Children's Hospital of Philadelphia, where I have both a clinical practice, and then I also do QI work and harm prevention work. So currently working, leading a harm prevention initiative there. And I'm going to be helping, we're opening a new second children's hospital outside of Philadelphia. And I'm going to help with some work there with cardiac arrest responses and responding to patients who are deteriorating. So very much looking forward to that. From an academic perspective, I came to Penn as a BSN student. I was similar to Dr. Becker, a first generation college student, and never imagined myself at an Ivy League school. And at Penn, I think the resources and connections I made really shaped my career. And I'm so glad that I had that opportunity. I went on after my bachelor's degree. I worked for a bit, again, in critical care and transport and things, and then went to the master's program at Penn. At the time, it was the pediatric critical care nurse practitioner program, which is now one of our concentrations, but I'm board certified as an acute care nurse practitioner, but really specialize in critical care. And then later in 2010, I actually completed my DNP at Case Western Reserve University in Ohio in Cleveland. So I've really used all the things that I've learned across the years to take care of patients, to do quality improvement, to do program development, to try to create systems and processes to improve safety of care, efficiency of care, and better care delivery, and just in general for infants and children, and generally those most at risk, so those who are critically ill and injured. And that's really kind of where my passion is. Like Dr. Renz, I left actually, but I came back to Penn. So I worked in Florida and then Washington, DC, Baltimore region. for a number of years and came back to Penn in 2014, came back to CHOP. I started teaching then as just a part-time faculty member, and a few years ago took over as the program director of the pediatric acute care and the neonatal nurse practitioner programs. I also help provide some DNP student mentorship for their projects as well, which is a really fun opportunity. I'm really, like the others, love nursing, love the opportunities it's given me. I've been a bedside nurse. I've been obviously a nurse practitioner. I've been a nurse manager. Again, I've been able to lead big projects for institutions and really feel like I've really impacted care in a big way. So it's been really rewarding. And I think, as Dr. Becker said, you can always do something different. There's always something different and exciting you can do to mix it up. In terms of, just Penn and our programs, just, very briefly, I think when I came back to Penn and sort of took the lead on the PEDS acute and neonatal nurse practitioner programs, I've been really excited to work with our, faculty, where we really provide close faculty mentor or close faculty student mentorship for our students, and also really excited and have been really energized by community engagement. So our acute care students and PEDS acute care and neonatal nurse practitioner students all get to do community engagement. And I think I've learned so much, even as a faculty member, by doing that. And it's enhanced my practice so much, and just really love the fact that my academic roles, the things I'm learning about community engagement and the importance of that work, my quality improvement and harm prevention work, and my clinical work are all just symbiotic and really have created a very rewarding career and opportunity. And it all started, again, with those who sort of encouraged me in my BSN at Penn. So I think that's it.
Great, thanks, Jessica. We have a few questions. Looks like they're mostly related to the MSN program, so let me go through there. One question, I am a current ABSN student with hopes to submatriculate into the pediatric acute care MSN program with a concentration in critical care. Do you have suggestions for looking for pediatric ICU experience with CHOP having a current hiring freeze?
Why don't you just email me offline and we can discuss that offline? Certainly there's a lot of institutions that are having financial struggles because of COVID. I do expect that in the next coming months that those things may change, where volumes are changing, the world is changing with vaccine, but I'm happy to talk offline about that.
And then there was another one, Jessica, keep moving up. Let me see if I can find it again.
There was another question. Someone has 4 years of pediatric experience mixed with acute and post-acute care. How much experience does one need to go for pediatric acute primary care?
Is that primary care or acute care? I'm not sure which program.
I'm not sure either, but
just talk about both, actually. Yeah. Sure. So one of the things that's unique at Penn Nursing, and I'll let Dr. Renz address the primary care piece, but for Penn Nursing's pediatric acute care nurse practitioner program, is we do require a minimum of 1 year of clinical experience post-orientation. So, generally when you have a new job, you do an orientation, and then once you're off orientation, we ask for a full year of clinical experience in the area that you'll enter your concentration. So if you're interested in the critical care concentration, that year should be in a PICU or a cardiac ICU, not a NICU or an ED. They're different patient populations. If you're interested in the oncology concentration, it's a year in pediatric oncology, not adult oncology, again, different populations, different care. And if you're looking at the acute chronic concentration, it's a year of minimum, again, of acute care experience. And that can be a variety of different care areas. And really the reason is we want to build on the foundation you've already laid, and really, take those foundational skills and build on them and elevate them. So I hope that answers your question. And if you have any specific questions about you as an individual, again, feel free to email me as well. And Dr. Renz, I don't know if you want to address the primary care piece.
Yeah, it looks like the participant wanted to know about acute care, but I will say for the primary care tracks that there are no requirements in terms of nursing experience, but it is recommended. And many of the applicants to our programs have at least a year experience working as a nurse in an area of focus for peds primary, working with children, for those working or in adult gero who've worked with adults, and FNP as well. So it's not required, but it's recommended. And it actually, I think all of us probably would agree that it does help students in the master's tracks to have nursing experience, because it is a big transition between being a nurse and being a nurse practitioner or advanced practice nurse.
Thank you. And just to clarify, again, I think I mentioned, like, for the acute chronic concentration, any acute care area, it could be inpatient, different kind of inpatient units, pulmonary, cardiac, et cetera, surgical, medical. It can be the emergency department. We do have some students who have NICU experience who come on and do the acute care, acute chronic concentration. So again, you're welcome to email me offline if there's a specific question. I'm sorry, Melissa.
No, that's okay. Before we move on, there's one question here that probably for anyone on the panel. COVID-19 has amplified the need for nurses to be more diverse due to health disparities in the U.S. How does Penn assist me with providing optimal patient outcomes?
I'll say in the primary care tracks, if you're speaking about master's programs regarding your question, there is content and clinical experience that are woven into the curriculum that help to address how health disparities are identified and addressed across the population. So I know that is contained in didactic content, simulation experiences, and then a very deliberate placement of students in sites where the underserved are served by healthcare providers. So I think it's been very much intentionally woven into the curriculum.
And I would say very similarly for, I'm sorry, Debbie.
Sure, go ahead,
You can go ahead if you want. Go ahead. I'll go third.
I was going to say, to build on what Sue was saying, we also make sure that we frame all of our discussions and content that we provide to you from an evidence-based perspective. So you're not getting the Debbie Becker School of Nursing Care, because you would not get anywhere with that, but you will get it from the Penn program, because we bring in specialists who are practicing in the area, have done research in the areas. We're citing the most current research that's being done, what is actually happening on the leading edge of medicine, but then also what the practices are across the country, because you may not necessarily be in a large academic center like Penn, but you will be in a place that will address certainly, the care of patients that have a variety of socioeconomic, social determinants of health and health disparity issues. And so we ensure that you're getting that content throughout the lectures, as well as the readings and the prep that you do for classes. And in addition to that, like Sue was saying, to make sure that you have opportunities where you, in clinical practice, you are going to be caring for patients of a variety of different health issues, as well as health disparities or socioeconomic issues that you will be addressing with them. And we have you, purposefully look at social determinants of health and why your patients are coming into the hospital, maybe returning to the hospital after a couple of days of being home because they just don't have the care that they require at home, and having to look at where we have to then maybe just disposition them elsewhere other than going to the home right away. And then, so we are making it very purposeful that you have these opportunities to really engage with the issues, the social issues and disparity issues, as well as with the health issues of the patients.
Yeah, and likewise for Peds Acute, we have objectives in our clinical courses related to social determinants of health and health disparities. Again, all of our students do some sort of community engagement work where they're engaged in the community. We have students participating in collaboration with the School of Medicine on a social needs response team. We had students, at some of the food distribution sites in Philadelphia doing work there, at food pantries, things like that. So really looking at the communities in need and not only just learning about it, but being, sleeves rolled up, out into the communities, helping those in need and really understanding what it means to manage health when there are disparities. So really actively engaged in that as well. We also do, didactic content on social determinants of health and unconscious bias and all those sort of things that I think are so important to all that we do. So I hope that answers your question.
Great, thank you. Okay, we're going to move on. We'll come back to the questions a little bit later on. Keep the questions coming in. So now we'll pivot and we'll talk about our doctoral programs. And now why don't we start with Dr. Brooks Carthon and talk about our PhD program.
Melissa. Hi, everyone. It's nice to have a chance to speak with you about our PhD program in nursing. Thank you for joining us on our virtual call tonight. So I don't know how many of you are from an HBCU, but I actually did my undergrad work at North Carolina A&T State University. I wore my Aggie Pride shirt today.
Oh, you snuck that in because I would have worn my
I did. I didn't see anything. So Aggie Pride to all of you, if we have any Aggies in the house. And so I have actually been a nurse for over 20 years. And it was really at A&T where I, really found my passion for nursing. But it was also there where I saw such a diversity or a diverse faculty. And it was there that I learned to see the possibility of myself going beyond the baccalaureate, going on to the master's, and of course, coming to a time when I wanted to pursue my PhD. And it was actually at A&T. Okay, I see Eagles in the house, North Carolina Central. But it was at A&T where our dean told us, and I'm sure many of you have heard this saying, is that your pursuit in education is a journey. And many of you are continuing to pursue your journey. That's why you're on this call tonight, because you're thinking about the next steps. And so I don't know if at 18 I knew what a PhD was or did, but I'm so happy that the seed was planted then to continue to explore all that nursing had and offered in terms of a profession and all that I could do in service of patients. I always say being a nurse is an honor because we get to share the space with parents, patients, families, communities at really vulnerable times. And so, after leaving A&T, I worked as a nurse at Duke and then went on to the University of Pittsburgh. And I was there for 2 years and came out as an adult health and a psych NP. And it was in Pittsburgh where I had a chance to work in a community health center. And it was there that I said, now I have my passion for nursing, but I have my purpose, because it was in that community health setting that I could see the needs of our community right in front of me so stark. And I knew that this is where I wanted to spend the rest of my career. So I want you to know that back in the olden days, there were no real computers to go into LinkedIn when you wanted a job. And so when I got ready to look for a job and leaving Pittsburgh, I sent resumes to New York, to Philly, and to DC, because I said, I want to work in a community health center. And like I said, this was the olden days. And so no one called me back, and probably because there were no jobs available, I just kind of sent out resumes. And where I ended up working was actually in the suburbs of Philadelphia, and then in the suburbs of New Jersey. So not exactly where I thought I would end up working, because remember, I said I wanted to work in a community health center. But even in those spaces in the suburbs, we cared for patients from all backgrounds and all walks of life. And it was in those spaces that I, again, was able to see disparities in clear display, because I was able to see who was able to afford medication, who had rides and support to their clinical visits, who had to wait for public transportation or medical vans, sometimes for hours, to be picked up after being dropped off from an appointment. And it was also there that I was able to kind of recognize my role as a nurse practitioner, and I was able to leverage it because I had privilege as a nurse practitioner. I could get on the phone, I could make calls, I could serve as an advocate, I could relate, I could educate, I could, I could kind of sit in between. So I was in the interface. I knew the healthcare system well. I had communication skills as a nurse, and I was able to engage and interact with my physician partners because I'd been trained as a nurse practitioner. But as you can see, I was also in the midst of a very broken healthcare system because it very much privileges the haves over the have-nots. And so when you think about, well, is a PhD or doctoral education for me, these are the things I want you to ask yourself. Do you have a burning clinical question? Check. Are you intellectually curious? Check. Are you a problem solver? Check. If you said yes to any of those things, and I have others, but I just want you to really think about that, because these are the types of questions and characteristics that fit well with pursuit of, in this case, I'm going to speak more about the research intensive doctorate, but a doctorate overall is going to help you not just be a problem solver, but have the time and the space to really think about being solution driven. And it was while working in clinical practice that the physician I worked with put a flyer for an open house to Penn on my desk. And it was for the Penn PhD program. So unlike some of you, the notion of Ivy League and Penn was just never in my lexicon. It just wasn't a part, it was close. That's as much as I knew about Penn. It was in Philly and I worked in Jersey, and that's about as much. But again, you always have kind of these people and these mentors or your internal desire to say, next step, what's next? And this physician knew that, I was primed for the next step. And so in applying to Penn, I really thought I was going to study, my clinical focus, which was traumatic brain injury. That was the thing I was going to study. I'd seen disparities. I didn't know health disparities was a whole field of study that I could come in and actually spend my career trying to address and fix. But it was in coming to Penn that I was surrounded by mentors, and I had the opportunity to really think about not just nursing in the abstract, kind of being one of the ways we think about addressing health disparities, but really empirically studying the nursing workforce and figuring out how we can leverage our own ability to work, our own ability to solve problems, our own ability to be advocates. And so as a health equity researcher, I study healthcare systems, I study the way they operate, and I study the way they organize nursing care delivery. Unfortunately, what I've noticed is that many Black, brown, and poor people are in healthcare systems that are not tailored to meet their needs. And it's unfortunate because the nurse staffing, the resources are lower in those particular facilities. And because these are systems that were designed, I believe they can be redesigned, and they can be redesigned to serve better the people that they're providing care for. So I currently am the executive director of a clinical pathway at Penn Presbyterian, which is a hospital in West Philadelphia. And we provide wraparound services and transitional care support to low-income, chronically ill patients who are leaving the hospital and need more support when they go home. In addition to that, I am the chair of our PhD program. We call it a graduate group chair, which is a little confusing, but basically I'm the program director for the PhD program. So if you have questions about admissions, about what do you do? How do you apply for this PhD? How do you go about it? I am happy to speak with you offline, and I invite you to our open house in the fall. I hope you receive emails or a flyer or something like I did that serves as a prompt and a reminder that there are many opportunities in nursing, and I would just really look forward to encouraging you to explore a research path in addition to your clinical paths as well. Thank you.
Margot, can you speak a little bit about the CHOPPER or the two centers in particular, generally how that fits into the PhD model?
Yeah, when I think of, well, not when I think, our PhD program is basically something I regard as the apprenticeship model. And so you are accepted in the PhD program, but you are matched and mentored by faculty. And our faculty have clinical specialties or population specialties. Within our School of Nursing, we also have two centers. And those centers basically are intellectual spaces where faculty share pretty similar research interests, but they have their own kind of, I'm just going to say they share similar research interests. And the two centers, one is related to care transitions. The director is Mary Naylor, and the other is the Center for Healthcare and Policy Research. The founder is Dr. Linda Aiken, and the current director is Dr. Matt McHugh. The focus of CHOPPER is related to the healthcare workforce. I'm an affiliate of CHOPPER, and so we do work in health equity, and we look at policies and practices that shape patient outcomes and the way that relates to the nursing workforce. And so not all of that work is in hospitals. Some of it's in community clinics, sometimes it's in acute care clinics, sometimes it's with NICUs and PEDS, and so it really is diverse in terms of population. The unique thing about our centers is that they have funding support for a PhD, and those students they are a part of what we call a T32, which is just a funding mechanism. But students who are accepted into the PhD program and then are accepted into one of the T32s receive additional specialized training in either transitions or health outcomes research with faculty who are associated with those centers. So there are some other expectations, but that's just the broad differences. And again, T32s select their students from a central application pool. So they don't have some separate way to apply to them. You apply to the School of Nursing. If you have a fit or an interest that aligns with those two centers, that's great. If not, we have fabulous faculty that are not a part of those T32 centers. And so it's just important to find a match or a mentor with a faculty mentor who has a research interest that aligns with your own.
Great, thanks. And we really encourage prospective applicants, if you're interested in our PhD program, go to our website. There is a page that has our faculty, and it lists their research area, because one of the key to be successful in getting admitted into a PhD program is really finding that match, that fit with a faculty person whose research might align with yours. So we really encourage prospective students, if you find a faculty member that may have some research that aligns with your interests, feel free to reach out to them, connect with them. Our faculty are very good. In fact, they welcome prospective students to reach out to them to see if there is a good fit and if they can support you when you apply to our program. So we really encourage that. So you can go to our website, you can contact the admissions office. We'll try to, direct you in the right to the right faculty member. But that really is encouraged. There is a question here, Margot. It's if I'm a current BSN student interested in becoming a nurse researcher with a focus on health inequities, would you recommend getting clinical experience before applying to the PhD program? Will lack of experience affect competitiveness of an applicant?
No, and so no clinical experience is not a requirement. We actually have a BSN to PhD track, and several programs that have been successful and specifically designed for the BSN to PhD model. I think Penn is not the only university that does the BSN to PhD, but I do regard it as one of our hallmarks. And we think of it as one of the innovative spaces that we have marched forward in terms of doctoral education. We have a Hillman program, RWJ, and one of the facets of Chopper. But in general, if you are a BSN student and you know, like, I want to be a researcher, we don't, there is no requirement that you have to have clinical experience. The one thing I will say is that if you know that you're interested in health equity, then I would encourage you to be engaged. And so engaged in your community or engaged in, a space that's going to help amplify your understanding of the inequity that you are interested in. And so there are lots of ways to do that through volunteer or other types of work and engagement. So I think that's just going to help amplify kind of your connection to community and to those experiences and into being solution driven. But you do not have to have clinical experience in order to pursue a research intensive PhD.
Great, thank you, thank you. We're just going to move along and then we'll come back to questions. Next, I'd like to turn it over to Dr. Dawn Bent to talk about our nurse anesthesia program.
Hi, glad everybody could make it here tonight. And I am sort of I'm a bit of an introverted person. So like when Melissa said my name, I was like, oh my gosh, my heart rate was like 150 for a second. But I think I've always wanted to be a nurse. I share with Jessica that I've always wanted to be a pediatric nurse. At that, I share with Dr. Lewis that I am actually the first one in my family that was born in the United States. Both of my mom was born in Jamaica, and so was my sister. So I come from a single mom. Although I say that, I grew up in a household with 5 uncles and 2 aunts and my mom and my grandparents. So I had one mom, but I kind of had, 10 parents, it seems like. It's everybody stressed education. And so we all knew we were going to college at some point. When I was in high school, I knew I wanted to work with children. So I think I said I wanted to be a pediatric nurse or a child developer. I think I made up that child developer thing. I don't even know what that is, to be honest with you. And I graduated high school. I went to nursing school. I went to Temple. I liked it so much. I went there again for my master's degree. And I became a nurse anesthetist. And it's interesting because I worked at St. Christopher's Hospital for children in their pediatric ICU. That's where I started my, not really started my nursing. I graduated and worked at Medical College of Pennsylvania for a year because that was required of me to get into an ICU at St. Chris. And so I went to St. Chris and worked 8 years in the ICU. And one of my colleagues there, he told me, I think you'd be a really great nurse anesthetist. And I was like, first of all, I don't know what it is. I don't know how to pronounce it. But I'll kind of figure it out. And I went to the OR with him one day and I shadowed him for a day and I was like, I can really do this. One of the things that struck me is I remember my interview when I was going into anesthesia school, and I'm pretty competitive. I ran track, I did gymnastics. I mean, any sport I would do, climbing walls, whatever, I would just do it. And I always thought that would always be better than the next person. So in my interview for my anesthesia program, I distinctly remember one of the interviewees asking me, why would we let you in our program? And that like struck me. And in my head, I thought because I'm really going to be good at it, but you can't really say that in an interview. So I don't even remember what my answer was, but here I am 20 something years later into nursing and 17 years into being an anesthetist. So education, how did I get involved? When I graduated in 2004 from my nurse anesthesia program, and that was Temple and Pennsylvania Hospital had a joint program. She was the program director at Penn prior to me, a couple years prior to me, and she was my assistant program director at Temple. And she asked me to come and just help in simulation, and I was like, why? I'm not really a good teacher, and I always thought like you have to learn how to teach too. And she said, no, you'll be fine. It's just debriefing with the students. It's not a big deal. And so I took her up on that and I would come like once a month and, help in simulation. So that then led to, teaching a lecture and something very simple, perioperative emergencies. Can't go wrong, with perioperative emergencies. You can't mess it up too much. And so I said, okay, I'll do that. After that, she wanted me to teach a class with her. Then it was, you're going to be the course director for this class, and so on and so forth. And everything she asked me to do, I just said yes to. And that's kind of, I always lead it to her that this is partially why I am where I am, because she challenged me and I accepted the challenges that she put before me. Being a program director here was never, ever in a million years something that I wanted to do. I was happy with my clinical practice at St. Christopher's Hospital. I did pediatric anesthesia, which was great. The little kids, you can't drop them too much. They're so small. It's not like an adult patient where you're moving them over and you're like, oh my goodness. So I loved working with the kids. And I was, again, part-time faculty at Penn, enjoyed it. I loved the students, just kind of being in the classroom with them and things like that. And when the opportunity presented itself to be the program director here, the first question I asked was, well, what if I don't do it? What's going to happen? And the answer to that was, oh, we'll do a national search for program director. And it was at that moment where I realized that the students went through a lot with the program, just, changing and shifting and going to a DNP, that I was like, okay, I have to do this. And so I took the opportunity to just jump, both feet in and go full time in education. Never ever, like I said, I enjoy clinical practice. And so it was something that I was kind of like, oh gosh, why am I doing this? And I said, sometimes you have to step out of your comfort zone and do things for other people. And that's what people did for me along the way. So that's what I try and do for the students along the way. Some of the aspects of what I consider like kind of my mantra, always say yes to opportunities that present themselves. So a lot of you are sitting on this call going, I don't know if I want to be a nurse. I'm not sure what I want to do. You don't have to have a direct plan right now. There are so many aspects, like Dr. Becker said, in nursing. You can do whatever you want. You can make it up along the way and it's going to be fine as long as that's what you want to do. It's funny, every time I am in front of my colleagues, and I call them my colleagues in the Claire Fagan Hall, anytime I hear them speak, like I truly get inspired by their conversation. Like I'm listening to, Dr. Brooks Carthon and Dr. Renz and everyone. I'm like, oh my gosh, that's so great. And I'm like, oh wait, I work there too. It's really something to be aspired to come to Penn. So that's kind of my little chit chat about Penn. I love every aspect of what I do now. I have just enough of my, foot in things with academia. I still work in the OR 3 times a month. So I like to keep my hands in clinical practice because I like for my students to see that, yeah, I do have relevance in anesthesia as well. Like I'm not just teaching you or reading the books, I'm still in clinical practice and doing all of those things to stay clinically relevant too. Other things about me, I enjoy the classroom. I enjoy being neighbors with Dr. Becker. She and I are neighbors in the hallway. Dr. Renz and I are neighbors as well. And, it's just an environment. Being at Penn is, you will be able to, achieve just all of those things that you want to, because you walk in the building and you realize that everybody is on your side. Everyone wants you to do the best that you can. And we want you to leave Penn, the best version of yourself. No one's coming to change you, or you don't, to be somebody else, but we take that person that comes to us in a program, and our desire, our goal is to make you a better version of who you were when you walked in the door. So those of you who are going to be here, welcome to Penn. I always say that to the students. That's kind of my thing.
Great, thank you, Dr. Ben. There is a really good question, and it's around the admissions process. And I think this is I appreciate, Heather, your honesty in this question, so I'll just read it. Dr. Ben, I currently have my BSN, 6 years nursing experience, 4 of those in ICU. I applied to UPenn last year. However, the admissions committee was concerned about my undergraduate science grades. UPenn is one of my top choices for a CRNA school, and I'm trying to make my application competitive. I'm taking a graduate level course and in biostatistics course over this semester is taking a grad level course better than retaking a basic science course? Is there anything else I can do to be more competitive? So that's a big question.
No,
Huge.
I'm going to start an answer by just saying that from, the admissions process at Penn Nursing, we talk about holistic admissions. So it's not, we look at, and many of us that are here tonight sit on the admissions committees, where we consider kind of the applicant, the total applicant. So it's not just based on metrics. And so you should, if you ever are hesitant to apply because you don't think your grades were good enough, but you have amazing life experience and a story to tell and a passion for nursing, please apply.
I mean, I would echo what Dr. Renz just said as well. I know that when, a lot of times applicants come into our program and they're worried about, I don't have a 3.8 GPA or I don't have a 3.9 GPA, and everybody is so much more qualified than I am. We look at the entire applicant. People come to us with things that happen in their lives. I mean, a lot of, in their bachelor's degree programs, they may have been an athlete and it was just the season that they were in and things like that. And these are those questions that we do ask during the admissions process. When you're interviewed in our program specifically, we will ask you like, okay, we see that your, I don't know, your bio or your A&P grade wasn't that competitive. Like, can you tell us what was going on then? And people have I mean, life goes on outside of academia, regardless of if you're in school or not. Things go on. And if we can get that is just a thing of your past. I mean, we've all been there. I can tell you, and I tell my students, I was not the top student in my class in my BSN program. And I'm not scared to say it because it doesn't matter where you came from. It's where you're going and where you've been, or not where you've been, but where you're going. Sorry. So, if you have a compelling story and, somebody, I don't know, you did soccer and it was you're 17 years old going off to college. I mean, I had a 17-year-old who went off to college at UVA, and she and I had a long discussion about her 1.9 first semester GPA. It's okay. Like, you've got to work through those things sometimes. And, not everything that you go through can everybody kind of get you out of. You have to do it yourself. And if you have a compelling story that's not, life experiences, things happen, you'll listen to them.
Yeah, and I'll just add to that. There's nothing wrong with reapplying, right? This is a very difficult, admissions is not easy. And I've been in admissions for almost 18 years. And it's very difficult, particularly when you have limited spots, right? So for the CRNA program, we can admit 28 students and we might admit a few to be on our wait list. We're already admitting into our program 2 years in advance. So it's very competitive in that sense. And the reason being it's limited is because we find, and this is true not just for our nurse anesthesia program, but for all of our programs that have a clinical component, we find all of your clinical placements. So therefore, sometimes we're somewhat limited on who we can admit based on our clinical availability. And so it's not that you're not a good candidate, it's just that it is extremely competitive. So I would suggest that, you're on the right track on, if there's a course that you want to retake. I don't think there's a preference between a graduate level course or just taking a basic science course. We'll take that into consideration. Anything that's going to build, your academic acumen, we take that into consideration. And so there isn't a particular preference, but again, anything that you can do, while you're taking that course, you're still gaining that work experience. So we truly do look at your application holistically, and we really do encourage you to reapply. And it is perfectly fine. We'll try to give you the best feedback that we can give, and then you try to strengthen your application based on the feedback that we provide. So I know we still have to get in, Sue Renz, a little bit about our other DMP programs. The Postmaster's DMP and our executive leadership. So if you can just speak a little bit more about that. And I know there's going to be a webinar, I thought it was May 6th, that's going to go into more detail.
And I would recommend, I'm seeing some of the questions that come up in the chat. If you go to our website with regard to any of these programs, whether it's Dawn's program or someone had asked a question about health leadership, if you email the program directors, they will respond to you. So if you have specific questions and maybe want to describe, your situation or your interest, I promise you they will answer you. Because we get questions like that for all the time about people interested in Penn nursing. So Margot really, said some really interesting and on point things about, like, if you're thinking about being a nurse or becoming a nurse scientist, like, we all in our practices have seen and thought about questions that have emerged from the bedside, questions and problems that we think need solving. And certainly a nurse scientist looks at how to solve problems by creating new evidence, which is really the goal of the PhD. It's to learn how to be a scientist and to be able to problem solve through finding gaps in evidence and really creating new evidence. In comparison, the DNP is a clinical doctorate, and many of us that have spoken tonight have a DNP. And it's kind of neat to think about different trajectories based on what your career interests are. And if you look at PhD versus DNP, the folks that really look at DNP identify themselves mostly as clinicians who want to continue to work, at the bedside, clinical practice, educators, clinical leaders, CNOs, managers, whatever it might be, to help provide leadership and problem solving at the bedside. And then the other really cool thing is that, DNPs and PhDs work together on many research projects, because the DNPs tend to be the clinical leaders, and the ones that can help with clinical questions, for these questions that arise or these problems that arise that need solving. So our postmaster's DNP program, as you saw from Jamie's slide, is a 2-year online program that accepts applicants who have a master's in nursing. And it doesn't you don't have to be an advanced practice nurse for the postmaster's track. You could have a master's in health leadership or nursing administration. We just completed interviews and seated our first cohort for executive leadership, DNP. Again, a 2-year online program. This track that will be led by Dr. Sue Keim, who's also the director of the Health Leadership and Nursing Admin Program. Really, the admission requirements were really looking for applicants that had leadership experience, management experience, and fiscal management experience. So a little bit different than the postmaster's track. But there's a lot of information on our website about the DNP. And Dawn and I work very closely together on the anesthesia students that are completing the DNP. And Dr. Keim and I will as well for the executive leadership students. And feel free to email me directly if you have questions about the DNP.
There was a question about a capstone project. Could you speak to that, both for anesthesia and the other DNP tracks?
Yeah, and the students that complete the DNP programs, tracks, complete a scholarly project. We don't call it a capstone at Penn, but it's a scholarly or a clinical project that they complete in the site where either they work for the postmaster students or the anesthesia students. Typically, Dawn, I guess the site where at least one member of the group is doing a clinical rotation.
Yeah,
right?
unless it's with Dr. Driscoll, then that's a different story. But okay. Yes.
At the NIH. And all of the students that are in the DNP tracks are paired with a faculty mentor at the School of Nursing, and they work closely with the site lead or site mentor at the site where they're doing clinical or where they work to help with project implementation completion.
Great. Well, we are exactly 2 minutes away from our closing. And I know there was a lot of information that we provided to you this evening. One of the objectives of this was for you to really get to know our faculty and know a little bit about their journey and the programs that they oversee at Penn Nursing. We have lots of upcoming virtual events that we encourage you to attend, to continue to engage with us and learn about our programs. As we said before, we have our virtual open house for the MSN and Nurse Anesthesia DNP program, March 5th. We hope you can join us there. We will go into a lot more detail about the programs. We'll have breakout sessions for each of the MSN specialty areas and the DNP tracks. We will also have another MSN Nurse Anesthesia webinar on March 11th. As we mentioned before, we have a career panel with representatives from our Penn's hospitals. We hope you can join. They're going to talk about careers in nursing and opportunities at the hospitals. And then we have a postmaster's DNP and executive leadership webinar on May 6th. So we encourage you to stay in touch, to join our events. And again, if we weren't able to get to your question, feel free to email the program directors directly, or you can also email the admissions office. If we can't answer your question, we'll direct you to the correct person. So again, thank you all for joining us this evening. We had someone from all the way from South Korea. That was our furthest. So again, thank you again. And it was great spending time with you this evening. And thank you for our faculty panel for joining us this evening. Have a great evening and be safe. Take care.
Bye, everybody.